Hello, good afternoon. Today I'm going to be sharing some treatment activities that we can use to target specific goals with particularly patients with dementia. First, some patient information. This particular patient was diagnosed with mild to moderate early dementia, and the difficulties that they presented with were memory loss, executive functions loss, word finding difficulties, literacy skill difficulties, and specifically cognitive decline impacting instrumental activities of daily living. The long-term goal that we will be focusing on is that the patient will recall and complete basic daily events in 80% of situations with minimal to moderate cues when provided with an external aid and strategies by trained caregivers. The short-term goal that falls under that long-term goal will be patient will recall daily activities via retelling and answering questions in structured settings when given minimal to moderate cues with 80% accuracy. Now, the first activity that we can focus on is space retrieval training. And this specific activity can be done in a clinic, but also can be used with caregivers after some caregiver training is provided by the clinician. The first step of this particular strategy is that the clinician or caregiver can ask the patient a specific open-ended question that is functional and does not change. So the answer should always be consistent because that would be the target response. We're trying to elicit a specific response from the client or the patient. And all these questions should be, like I mentioned, open-ended, so not leading to a yes or no response. Some examples include a consistent daily task that the patient may need to remember to perform, like taking their medication, a name of a person that they know, or a place that they need to go to. The second step would be if the patient answers the question correctly, then you would move on to the next target question. But if they answer incorrectly, then you as the clinician or the caregiver would give the correct answer and then ask the patient to repeat the answer back. Then you would ask the exact question again and wait for a response. Responses should always mimic the previous given response, the correct response by the clinician or the caregiver. If answered correctly, then the clinician or caregiver will wait 15 seconds before asking the question again. Then they would ask or continue to ask the exact same question, hoping to elicit the exact same target response, always expanding the time in between asking questions from first 15 seconds to then 30 seconds, 1 minute, 2 minute, 4 minute, 8 minutes, etc. Repeat this if the correct answer is given. However, if the incorrect answer is given, then you would provide the correct answer and then go back to the last interval time. Now, an example with this particular patient, this patient is having difficulty remembering how to turn off the stove, as mentioned by a family member in their case history. So the clinician would first start asking the question, how do you turn off the stove? The patient may answer that they don't remember or they don't know. The clinician would then say, turn the dial to off and ask the patient to repeat that. So the patient would then say, turn the dial to off. The clinician would then ask again, how do you turn off the stove? And the patient would respond, turn the dial to off. Since this was the correct answer, then the clinician would wait 15 seconds before asking the question again. How do you turn off the stove? And the patient would say, turn the dial to off. And then again, since this is the correct answer, the clinician would wait 30 seconds at this point, extending that time, and then continue to repeat the questions, again, always expanding the wait time for longer unless the patient provides the incorrect answer. The second activity that can be done with this particular patient for the goal to target the goals is an external memory aid. External memory aids include tools that are used by individuals with dementia to help compensate for any memory deficits. These aids can do a lot of different things like maximize their independence, reduce anxiety in certain situations, increase conversations with maybe both familiar or unfamiliar conversation partners, and decrease responsive behaviors like them repeating themselves over and over again. Examples of external memory aids include having a daily planner where they can write down their tasks or maybe daily journal, having a checklist with all their tasks that need to be done for the day or in the future, be able to record messages on a smartphone or a small recorder, pill reminders, which can be electronic or not electronic, calendars, and memory books. And those are two examples that can be used to target specific goals in the area of memory with patients with dementia. Thank you.